Hello everyone and welcome to And Sleep. My name is Tommy Licatese. I have the pleasure of hosting pain management specialist Dr. Uel Alexis. Today we will be discussing chronic pain and sleep. Welcome to the show, Dr. Alexis.
Thanks for having me.
So why don't we start by asking the question, what is pain?
It is nothing more than the manifestation of a noxious stimuli. It increases our heart rate, it increases our stress hormones. It's a whole host of things that actually go on. It's a cascade of events that actually go on, but its primary role is critical and important. It's there to let you know that your body's in trouble. Something is wrong. Something needs to be addressed and taken care of. The problems that come with pain is that, one, it can be acute. You can feel it right away. You slam your finger in the car door, ouch, it hurts. Then you can have chronic pain, which is a bit more of a burden. So typically when something goes from acute to chronic, that's gonna be something that's gonna take several months to build up to. And I do use the word build up because it's more than just pain that we're dealing with now. Now it starts to affect other aspects of our whole life in general.
And can this pain affect one's sleep?
Well, very good. I mean, one, pain is a stimulus. And when you get this stimulus, there's nothing else like it in the world. You have to pay attention to it. It's difficult to sleep through it unless you're on heavy medications, for one. So one is just getting sleep. Then we have to talk about the quality of sleep that you're even getting. So there's several conditions. We can talk about shoulders, neck, the low lumbar spine. All three of those, all my patients, they complain about sleep. You can just think about it for a shoulder pain. If someone has a tear in their rotator cuff, when they go down to sleep, they can't sleep on that side. They have to sleep on the other side. So there's a touch to that. In addition to that, we have to realize that arthritis, and arthritis is nothing more than two bones rubbing each other, or inflammation in between two bones. Now, the cardinal sign of inflammation is pain after a period of rest. What is the longest period of rest? Our sleep. So it's quite interesting that pain can manifest itself during sleep. If we don't sleep well, we'll soon enough realize it.
Okay, and I guess the other way around, how can sleep affect your pain, or lack of sleep affect your pain levels?
Several studies have shown how defragmented sleep, poor sleep quality, can actually lead to heightened levels of your sensitivity to pain. So let's say you stubbed your toe. It doesn't feel like you stubbed your toe. It feels like a sledgehammer went on the toe, you know? I need a pain medicine for this. No, we don't need that. You just stubbed your toe. But don't worry about that, because the good news about that is it can be reversed. If your sleep starts to get better, we can actually start reducing some of the other elements that are not only just affecting your sleep, affecting your pain, but also affecting your life and your health.
Okay, so why is it important, or why is it so important for chronic pain sufferers to get good sleep?
Our sleep can definitely affect our pain because, one, if you're not getting enough sleep, you're going to be fatigued, you're going to be tired, you're not going to be able to think right, your immune system's going to be down, your body's just not going to have the energy it needs to do the functions that it needs to perform. So for me, I need that patient to participate in physical therapy. I need him to strengthen his core, whatever it needs. I need him to stretch. If he's demotivated and tired and depressed now, the combination of pain and lack of sleep and being alone and no hope and everything else, he's not going to participate and do what he needs to do to get better. So as in everything in medicine, pennies just add up to be dollars, and we have to look at every little thing because they do make sense and turn into bigger things if we do not resolve them sooner than later.
Okay. Do you have any tips on helping to cope with pain during sleep?
So coping mechanisms that you can do in terms of sleep are mindful techniques, image-guided techniques as well. Meditation has clearly shown to be of relief. But truthfully, I think even as physicians, we need to be looking at every issue and be more mindful as well of potential sleep disorders like obstructive sleep apnea. If that's the case, a person could be wearing a CPAP machine or some type of maybe an oral device that can allow them to sleep in a better position too. So there's many options, and we need to just be mindful, aware, look at them, talk to our doctors, and hopefully, get our questions answered.
All right, well, it sounds pretty helpful. Thank you for coming on to the show.
Thank you.
And that completes this episode of And Sleep, a Whole You social talk show series with Dr. Alexis. We encourage you to explore the rest of the episodes and visit wholeyou.com to learn more about sleep breathing disorder treatments. The sleep professionals in this video series teamed up with Whole You to spread healthy sleep education across America and were paid for their appearances.